mutana cikin gida za ta yi muna magana batun cervical cancer. Na san mutane da yawa dai ba su suna ji dai cervical cancer ba san ko menene shi wannan ciwo sosai ba. Cikin muna cikin month of breast cancer awareness month ne ana hadawa da cervical cancer ne ake yin duka gaba ɗaya pink month shi yasa ana yin duka gaba ɗaya ne. To muna tare da Hajiya Khadija Abdullahi ita nurse ne za su ta yi muna magana kan batun shi wannan ciwo cervical cancer na mata kaɗai ne ba sani ban dai maza na da shi amma tana nan ne ta yi muna ƙarin bayani. Hajiya san da zuwa an tashi lafiya ya sanyi kuma
alhamdulillah
gashi muna ganin saki ana muna dare cikin October to Allah ya muna amin. To Hajiya ba da bata lokaci ba ina so ki muna bayani menene cervical cancer inda abubuwan da suke kawo shi wannan mu dai san cancer ko ashe akwai daban-daban so ina muna so ki ba mu bayani kan shi wanga ciwo cervical cancer da kuma abin da ke kawo cervical cancer.
To assalamu alaikum once again.
Wa alaikum assalam.
Okay, so inde aka ce cervical cancer, cervical cancer, it is a tumor.
Okay.
That's it can develop around the cervix area na mace.
Okay, menene cervix? Wannan abin bisan cervix ba
ya ka ce
part of jiki ko ina ne ta wanne yake?
Ya ka ce cervix idan aka zo shi taurin mahaifan mata.
Okay.
Like there is a small opening da kamar like idan da ka haifu usually inda kan yaro ne yake bin yake fitowa. Oyin ne cervix din. So if akwai wadansu cells da ke develop around wannan cervix nan da like ko maybe tumor da ake ce ma cervical cancer, and then usually nan ina caused by one virus ne da ake ce ma HPV, that's a human papilloma virus.
Okay.
Usually it is contracted through sex. It's a sexually transmitted disease.
Okay.
So that's the virus that usually causes the cervical cancer.
Okay, shi kadai ne ga kaman gashi nan an samu diagram ko ba shi kenan ba. Okay. Yasa through sexual intercourse kadai ake samun shi.
Yes.
Okay, she cervical cancer. All right.
And then since it's through sexual intercourse, usually now akwai 3 like usually sexual sex through the vaginal parts, and then when you use the oral, that one you can get the virus, and then sometimes the anal as well.
Oh, okay.
That's the anus, the vagina, and then the mouth.
The mouth.
Yes.
You can travel from there to your cervix.
So when you use all these 3 parts, you can get that virus, that particular virus that causes the cervical cancer.
Oh, okay. All right. So menene factors in the ke increase shi munce de through sex ne dai ake samun shi, yankin ba mu 3 wuraren da zaka yi ka samu to me ke increase factor da zaka yi ka samu shi cervical cancer. Sex dai an ce dai baka ka bare matan aure dai halali ne kai ka ce baka ka ce to me ke increase wannan factor da zaka samu risk factor na.
So yazo shi risk factors na usually now it is considered common like na mace da ta fara have sex at an early stage.
Okay. How early?
Early like maybe in your early 20s.
Okay.
Because usually now kakai adolescent stage, so they feel common they are grown and then they can have sex. So usually when you start having sex around that age and now you are prone or you are at risk of getting the cervical cancer. And then when you have Canada several sexual partners as well.
Okay.
Like having sex with 1 or 2 people at the same time. You are at risk at all. And then when you have a very low immune system, and then usually when you smoke as well, it causes that, because when you smoke, it brings your immune system down, and then it cannot help fight other health conditions. So you are prone as well.
Okay, gashina ashanu na factors in kenan multiple sex ba in kana saduwa da mutane daban-daban ba mutum daya ba, da shan sigari da kuma family history da kuma anti-conceptives.
So when you take in like in kana dokan contra pills, contraceptive pills, then kana taking shit, or you'll be taking it for a long while.
Maybe
from 1 or to 5 years, you are prone or you are at risk of getting a cervical cancer.
Signs in the machine at the cervical cancer.
Usually now, when it comes to cervical cancer now, signs now, it takes a while for it to start showing.
Because you're not internal.
Because of the virus now. The human papilloma virus now. It is a virus now. Sometimes it can go on its own, or maybe you have to seek treatment. But if you don't seek and then it's within you, it takes a while. Sometimes it takes up to a decade.
Wow.
Before
10 years.
Yes, or maybe 5 to 10 years before it start developing. So she better like hearing early signs and but when it start developing, that's when you start having the vaginal bleeding. You have vaginal bleeding, and then you have a very painful abdomen, like when during sex. Very painful one. And then sometimes when you bleed in between your menses, maybe in kakari menses, the next time no can bleed. So and then you can go ahead and then be having a very heavy discharge. That comes with a very foul smell. No, Maza some cervical cancer because Maza bas the cervix.
Mata ki the cervix.
I understand. That's the difference.
But when it comes to the virus, Maza kuma na some virus in no one. But it doesn't cause cervical cancer in men. But in general, in about the bone. Something different.
Okay, kin ce wanga symptoms nan kaman kana nan shi ka ga cikin period ka kaman kai wanki ka kare shi ka zo kuma in between kana samun discharge, kana samun period kadan sannan kuma kana samun ciwon mara an ana saduwa da kai. Akwai abnormal ciwon mara ba kaman normal, in kaga kaman is abnormal shi ka je ka san kaman akwai matsala, shi ka je ka check ka je ka ga doctor a duba maka in akwai matsala kenan da samu a magance shi.
Duba batun da screening, where who should may wife je for screening, maybe early testing ne duba ko dai na da shi ko bai da sha ga alaman nan.
Usually because it happen with matter now. It is said matter if you suggest screening, but for someone who has already started having sex from 20 years going upwards, or from 21 years. Yes.
Screen for
if you are sexually active, then you have to go for screening.
Don me shi bayan ya samu kuma diagnosing na yayi ke yana da magani ko dai da magani.
Usually now it is been diagnosed before a diagnosing of cervical cancer now. Usually now you have to have some tests done. Maybe you have to take a test for the human papilloma virus to know if you are having the virus. You can go for a pap smear test. That one is a two-answer tube like adoki aduba ring wanganka cervix na adoki aduba, and then there is something called the biopsy. Biopsy as well, when then they will take some parts of the cells in your cervix to go for testing. So one and test results and a years out now, that's when they will know whether you have some of the precancerous cells in there, and then you can commence for treatment.
Okay. Many stages cervical cancer, most cancers the stages they are developing stage 1, stage 2, aka stage 4 they when then they kai la ba kompidu kai ba second she ma cervical cancer in the stages she ma ko dai shi dai in once ne dai na shi.
When it comes to cervical cancer now, usually now bar group into stages because of yandeke it is a bit complicated, and then because of take a while so now if I show we have something that we call the local invasion, the lymphatic, and then the hematogenous. So when it comes to the lymph node, you are talking about the lymph nodes. Sometimes kina come maybe nde kikajichi ka fanki kina feel wadan so kaman malulu kan kai
wannan ana cewa ya dururuwa haka Hausawa ke cewa.
Sometimes akwai chicken wiyan kananga in your groins, and then sometimes in your armpit. Those lymphs and sometimes it can develop precancerous cells, and it gets to the lymph as well, lymph nodes as well. So when it comes to the local invasion comes with the bladder, the anus, like the service area. From the cervix to the uterus, the bladder, and then your anus and wherever you have sex through. But when it comes to the hematogenous, it deals with only the blood. It can, and then with the blood, it travels very fast.
Share in a chicken system, blood, they must say
so when in a travel very fast. Sometimes I can classify it, but with stages and then it's a bit complicated. So we don't go with.
So many recommended treatments and diagnose mutunyana cervical cancer.
So when it comes to the treatments now, we have 3. Akwai surgery, akwai chemotherapy, and then akwai radiation. With the surgeries now, usually now, if cancer now be developed, too deep to the
blood level,
and then it hasn't gotten to the uterus and then all that now. Usually they go with surgery because you can have a surgery to take all the the affected area now. You take them out through surgery. And then with the radiation, then they use a radiation beam light. So they just place it at where the affected area now. And then it melts and away. And then when it comes to the chemo, the injections and then everything.
Chemotherapy.
She said, come on, cancers that can do consume, come on, treatments today, chemotherapy, radiotherapy, that surgery. Yes, I do can onions with that she surgery one good now. She said, Yanzu kuna awareness as much. Me kamata kiringa yiki na duban kanki saboda ki kare kanki kan wanga ciwo cervical cancer.
So as much I will advise that the moment kika hit come on like 20 sinki. Although it is not easy because when it comes to the test and all that sometimes in the sada. So unka hit 20 sinka from 21 going you should be able to have a test, a pap smear test done at least every 2 years. Every 2 years. At least every 2 years. You so called to check whether your cervix is okay, is doing fine, it's not developing anything at all in there. And then can have a test of the human papilloma virus as well. To know whether you're having the virus or not. And then with that, there are vaccinations as well. Akwai vaccine for the virus
human papilloma virus.
Yes. And so akwai vaccine. It's a one if you test and then you have the virus and then you can go for the vaccination, or you can more so if it is negative or positive, you can still go for the vaccination just to prevent from it going into the cancer.
All right. Questions to Haja Rashida na so kibamu final words nki kamwe ki Khadija sorry Haja Khadija Abdullah Haja Khadija ya nkuri na mix so ita ba ko na ta wuce da sunan ta Rashida shi sa ina mix su da kionku muna so kibamu final words nki zamu shemu wrap up kan
so my final words will be usually now Kama yanda muke the breast cancer awareness na. January as well, we have cervical cancer awareness that I can create. And then when it comes to that month, some of the big hospitals, maybe Rich Hospital, they have a free cervical test going on. The screening, they do the screening there free. So if you have a time and then maybe it's January, you can just pass by the hospital, ask, and then if you can have your screening done, then you do it. Since the pap smear test now, it's like you go in every 2 years, so you can use that advantage.
Every year, my friend has a January check every year
for checkup, and then.
Advantage.
I see advantage, but she awareness and she are very low as compared to breast cancer. I was to come look at breast cancer month. I was to in breast cancer screening as soon as cervical cancer chicken sunai wadan sura ne wasu individuals suke sai aka mata kuma ku bari na cervical cancer ne ai yabbazo aka asani don wannan nan bai taba zuwa bai taba ji ba
yana da tana da wannan
ciwo ma bai sani ba
cancer dai
komi cancer dai mugun abu ne sai aka mata January Allah da mun kawo ki muna cikin rayayyu mun kawo ki kuma ki zo ki muna karin aske kuma ki wayatar da mutane kan wanga ciwo. To Aja Khadija mun gode kwarai da kika ba mu dama da safen ga baki gashi da kowa.
Okay, na gaida ya sunan shi wata cousin she came from Ashama just few days. Sunanta Zikra Abdulrahman na gaida ita.
And then
ana gaida ki Aja Khadija na gaishe da ki kan Baina TV.
And then akwai wani friend ina kuma sunan shi Abdul Wahid. Shi ma I'm sending him shout outs.
Okay, to mun gode Aja Khadija. To masu kallo anan zamu kawo muku karshen shi tattaunawa da muka yi dan dangane da shi ciwon cervical cancer da yake kamuwa da mata. Isa in kana da kokarin kana da time in ka kwana da wanga symptoms duka kai ka je asibiti dan a duba ka in kuma ba za ka yi ka jira January in Allah ya da wai ana cervical cancer awareness wasu manyan asibitoci a cikin Accra suna yin free testing kenan. Allah dai ya ba mu lafiya. Thomas Kallo za mu dan zagaya mu dawo mu zo mu dora muku aikin yadda muka saba. Muna da baki a cikin gida su ne yan siyasa mun san kowane ranar Talata Tuesday kenan